And, we're really excited to share our first Caregivers Count campaign and with you guys and explore different ways that you are all able to participate and engage in the campaign. So to start, if I know we have a small group right now, but if we could all just mute our lines, enter any questions or comments you have in the chat until the end. And if you're able to, if you could turn on your cameras, because we would love to see everyone's raw reactions to our resources and everything. And we also would like to thank our sponsors, Johnson & Johnson, Bristol Myers, Takeda, and Grail, for allowing us to push forth our campaigns, particularly Caregivers Count. Without them, we wouldn't have been able to curate the resources that we have and make sure that we're able to disseminate this far and wide, of course, with all of your support. So we first want to give some background on the campaign, talk about what caregiving is and what it may look like, actions that you can each take throughout the month of June. And of course, we would love to get some reactions from each of you about what your thoughts are in the campaign and some of the resources and ideas you may have on some of the actions that you can take. So with the campaign, as mentioned earlier, this is our first Caregivers Count campaign. And one of our primary goals is to make sure that people recognize themselves as caregivers. Many people take on that role without realizing that they are caregivers. They just figure, okay, well, I'm just taking care of my child, or I'm taking care of my parent, or I'm just trying to support my neighbor who may not have the ability to care for themselves. And especially on the heels of the pandemic, many of us have seen people take on these added roles, whether it's you or a neighbor of yours checking in on someone in their community, or some millennials moving back home to take care of their parents. A lot of this really does speak to the diverse experiences that caregivers do have. And we want to make sure that we're helping not only people identify themselves as caregivers, but connect them to essential resources that they may not realize they're entitled to. So because a lot of people don't necessarily recognize themselves as caregivers, they may overlook some of the essential support services that they may have access to ease their caregiver experience, whether that's emotional support services or direct support as far as somebody can help them getting groceries for their family, or any financial support services. So we want to make sure that we're connecting all of those dots throughout our campaign. And again, this is our primary goal for Caregivers Count, just to help people make sure that they feel supported in their responsibilities, and to make sure that they feel a bit more equipped and confident when they're caring for their loved ones and for themselves. And so what is caregiving? Caregiving is very unique and different for everyone, and there's no one way to be a caregiver. So again, whether you're running household errands, helping administer medications or different treatments for a loved one, you are a caregiver, and that nearly can automatically pre-qualify you for a lot of support services that you may not realize you have available to you. So show of hands here, or you can drop it in the chat, if anyone on this call has ever been, or if you currently are a caregiver. Yes, Sarita, an amazing caregiver. So we want to go over some of our campaign resources as well for the campaign. So we have our Can We Talk About Caregiving resource, which offers 5 tips that helps people self-identify as caregivers, anticipate some of the costs that may be associated with caregiving, and help you navigate some of the resources and groups that can help you in your caregiving journey, and or somebody that you know who is a caregiver who may need access to some of these resources. And there we also have a caregiving policy explainer that Melissa can talk about a little bit. And of course, our campaign toolkit, which we will talk about a bit later. But for our caregiving, before our caregiver resource, I'm going to show you guys how to navigate on the website, so you know how to get there. Let me share a different screen here.
Just want to point out here, looking at the chat, almost everyone that's here on the call is a caregiver, has been in the past. So it's touched many of our lives, this role. And I think one of the things that Mary mentioned is just that, you know, whether or not you identify or recognize yourself in that role. And I'm curious, you know, we can talk about it maybe towards the end of the call, but to be thinking about just how, you know, if that was something that ever crossed your mind, or did you just feel like, you know, I'm the daughter who understands healthcare the best, and so that's why I'm in this role. But just something to think about. Maybe we can talk about towards the end of the call. All right, Mary, was just trying to fill in as you were getting your screen ready.
Thank you. Can everyone see my screen?
Yes.
Yes, perfect. Okay. So if you go on our website, you go to the volunteer section here and you just hit Caregivers Count. That will direct you to this campaign page. And so you're able to take a look at our campaign toolkit here, which you can download, and it is on a Google Doc as well. So you'll have a much easier time copy and pasting some of the social media suggested posts or any other information that you would like to share in the toolkit. So we provide some background on the campaign, ways you're able to take action. And some of the immediate actions you can take would be to sign up for our campaign digest, just so you have weekly updates, much like our Be a Hero campaign here. We also share our campaign calendar that includes all of the important dates that you will need to engage in our campaign. So it includes our kickoff call for today, our week of action, much like we had for a previous campaign, and one action that you can take per day during our week of action that you're able to do to support the caregiver, support caregivers in your community and amplify that experience, which is also written out here.
Mary, do you mind just making that screen a little bigger possible?
Yes, of course. That was probably too big, but I think this works. So we have on that Monday, you can share our caregiving resource via email. You're able to participate in our webinar, which I will drop the link towards the end of the presentation. You can share your video on Boast, join our Thursday Twitter chat with the hashtag Caregivers Count chat, and of course, recognize a caregiver on social media. And so sharing your story on Boast, this is very similar to our Get Covered campaign as well. I will show you what this looks like here. You just follow that link. You're able to either share your caregiving story or highlight a caregiver in your life or in your community and share the type of work that they do. Here's some quick tips to uploading your video. Here's an example of how you're able to start that video if you need it. And it's fairly simple. You're just able to type in your name, your phone number, your email, and start recording. You just need a camera, and it should be easy. If you would like to record it on not this platform and just choose to upload it, you're able to have that option as well.
And I just also want to note with Boast, you can use your phone. Again, you just need a camera, so you can use your computer like you're speaking to us right now. You can upload the video that way, or you can have someone record it for you. But it's very easy to use just using that link. And if you do have any problems, Mary and I are here to help troubleshoot if needed.
Yes. And yeah, so the toolkit just go over additional actions you're able to take. And of course, we have our sample post you're able to share on social media. So on Twitter, on Facebook, our Twitter chat, different ways you're able to share your story. We will be updating the letter to the editor section as well. So if you would like to contribute to a local blog or reach out to any local news outlets that you have in your community, we will share instructions on how to best do that. And if you would like to take any more actions, of course, you're able to email us. You can email me here, and I will drop my email in the chat as well towards the end. So it's a quick look at our toolkit there. And about Boast, I will next show the caregiving resource. So as discussed, just quick 5 caregiving tips. So how you can recognize yourself as a caregiver, cost anticipation, how you're able to support yourself in that caregiver journey, how you can personally identify or help other people to support within the caregiver space, and of course, some of the caregiving resources that we have. So there are direct links to different resources that you may need. So general support services, community support, financial assistance, coping and emotional support, and educational guides as well. And I will have Melissa talk a bit about the policy explainer. Melissa, did you want to share your screen, or are you?
I think yeah, it's fine. You can leave it there. Our policy explainer was developed by us. Nicole, Rebecca, and I had a hand in putting this together. And really, this is more of a resource for our volunteers to show you what it is that we are doing to address, caregiving as an issue. And so, we talk about who caregivers are. And I think the main point is really the second page that showcases some of the policy proposals that we're supporting as an organization, but specifically how needs navigation is that, that lifeline for caregivers, as well as patients. And so we really just wanted to emphasize that point. And it also just this resource also breaks down just the things that we at NPAF just truly advocate for in how we want to support our caregivers. And so we've highlighted some partner resources here as far as data. We'll be augmenting this slightly with some updated numbers as well from a partner of ours, Archangels. But yes, so this is a resource for you to learn more about how you can understand more about just the policy work that we're doing here in the caregiving space. And, if you find that as you're talking to people in your community about, Caregivers Count, how the importance of just connecting people to resources, and they want to do or learn more about the policy, this is certainly a resource you can direct to them as well. So I think that just wraps up the policy explainer. But happy to take questions about that resource or any of the other ones that Mary has showcased.
Melissa, can you talk? It's Rebecca. Hi, everybody. Can you talk a little bit more about how we might be using the Boast videos, the stories that people will be supplying? Because that's a really key thing to get those short video vignettes. We really want to encourage everybody to get some of those on there for us.
Absolutely. So with this particular campaign, we are using Boast to essentially collect. It's an easy way for us to collect everyone's testimonials. And what we want to do with Boast specifically is, in the context of this campaign, it's actually a day in our week of action where the action step for you as a volunteer is to upload a video. And what we really want to showcase here is just your own personal, testimonial about why this campaign is important to you. So if you're a caregiver, you can talk about what that caregiving experience has been like for you. Why, again, sort of emphasizing why this campaign, why recognizing yourself as a caregiver, and understanding that there are resources available to you, why that is so important. I don't believe we have Jessica Jones here yet, but she has already sent us one just showcasing her experience as both a patient and a caregiver for her son. And we really think these stories just collectively, what we'll do is, we'll either promote them on social media, have them on our website, so people can put, faces to the experiences that, collectively caregivers go through. And, so I think these are, I guess, the point we really want to make here also is that these are short vignettes, just very clear points. And so I'm not sure, I think it's a little hard to read on the screen right now, but if you do go on the BOAST website, we give tips as to how you can sort of set the stage right, but also provide you with prompts about how you share your personal experience. And Mary and I are available if you need to do a test run beforehand, we're available to, to be there as support if you need it. Was that helpful, Rebecca, to sort of explain?
I hope so for others. I think the key, yeah, absolutely, yes. The key here is the relatability, caregiving. Those of you who participated in the recent policy consortium or have listened to the podcast that Ashley Freeman hosts will know that caregiving can be a very isolating experience, especially with the pandemic. And so having a sea of familiar faces who might not be familiar because you know them, but because of their experiences as caregivers, that helps overcome some of that isolation. And so we want to build that library, if you will, of a friendly room through these short vignettes where people can see themselves in relatable others, and so that it grows. And I think that's a key opportunity as a resource we should all be thinking about as an organization to help find your community, as we always try to do. But caregivers often are overlooked for all the reasons that Melissa and Mary said. And I think that these vignettes can be a really helpful way to draw in people who otherwise might feel very alone.
And I also just want to add to that by saying, we focus so much. If you've been a volunteer with us and have attended a patient congress, we know the power of the patient story, your own personal story. We've emphasized that as as far as how you talk with your family and our Be a Hero, Make a Plan campaign. In patient congress, when we do Story Slam, we know story sharing does build that community, and both allows us to sort of have that in a virtual way. So we hope you are, we know it's might be outside some of your comfort zone to share those experiences, but we're hoping, that we can really build that sense of community. I think I saw Rebecca Barnes join this call, and she's, has mentioned to me on a call previously that we've had together, how when we have these types of campaign calls or just our check-in, our regional calls as volunteers, how wonderful it is to just connect with other, like-minded individuals who are going through similar experiences or share the same passions, and translating that to these vignettes. And, we hope that, we can use them as content both for our website, both to promote on social media, again, to just highlight the experiences that caregivers in this case are going through.
Definitely. I think Melissa and Rebecca definitely covered everything, all the important elements and sharing your story. And of course, so many people don't identify themselves as caregivers. So having that, if you have that experience, you being able to communicate that via a blog or a video, whatever form you're most comfortable with, would be so powerful for people to hear it from somebody who has that current experience or has previously gone through that. So that's definitely a huge reason why we would love to amplify that. And we would love to hear from each of you about how you would plan on bringing this Caregivers Count campaign to your individual communities.
And I just want to know, I know many of you who are on this call now also participated in our Be a Hero campaign, and you'll notice the actions and the ask here is scaled back from that. This is the first time we're doing this campaign, and for us, it's really just, we want to raise that awareness about, you know, helping people recognize themselves as caregivers and direct them to the resources that are out there. So it is scaled back if you've noticed, but that was the intention. But Brittany, I see your hand. Love to hear your idea.
Hi guys, I'm so glad to be back.
Yay.
I did the symposium for caregiving, and I mean, I've never been a caregiver, but I got so much insight from everybody that spoke. It was really, really, really cool to hear the stories. I definitely was very excited about this campaign because my grandfather has dementia, and my grandmother has been, like, I told her we were doing this campaign, and she was like, oh my gosh, please let me know like what you find out. And so I hope that I can be of help to her. And I guess in terms of what I want, like my plan to bring Caregivers Count to the community would be to help people like that kind of they're put in this situation, they don't really know what to do, and just learn all I can. And that's basically it.
That's awesome. That's exactly what we want you to do too, is yes, reach out to those people who, you know, might not have the time to find the resources that we've been able to put together. So I love that, Brittany. Thanks for sharing. I'm gonna probably call on some names here that I see. Mary Stabile, I know you often have such great ideas and connections. I'm curious to hear how you might be able to bring Caregivers Count to your community.
Can you hear me?
Yes.
Oh, I've been having audio problems all morning, but I'm glad you can hear me. I think, well, one of the things that Be a Hero was a great model of how to start initiating getting this out to your community, which I would imagine is throughout my state of New Jersey, right? It's not just a local idea. So as we know, Facebook, go on to groups, the caregiver groups on Facebook. Put stuff on your own page too, and get people to go on the groups, get to allow you to put some information on their pages for caregivers. You get I got a lot of feedback that last time with the Be a Hero plan. One of the big things is, of course, Twitter and Instagram. You reach a whole lot more people where they gather around the old-fashioned water cooler, I guess, where you find the people. For me, locally, Nextdoor, that app, I go on there and I post all about that. And I also look on Nextdoor, I mean, on Facebook, they have communities, like it would say Bordentown, where I live in Bordentown, they have a Facebook page. So a lot of the communities have their own Facebook pages. So you can actually get into that community, you know, or town, you know, and put information on that people want to know about, and then they can have a discussion back with you. And a lot of people chime in, like they want to know more. So that's one good way of getting into your local communities, is find your local community Facebook page. As you know, Mary and Melissa, I do coalitions a lot. And I also see who else is in healthcare that would want this information. So that's another way. Your hospital public relations media person at the hospitals, they would love to know about what you're giving, so they can present it on their newsletters, on their Facebook pages. So that those are some ways to get it out, and I hope that helps.
Absolutely. Always does, Mary. You're amazing. And I think hearing your ideas, I think will hopefully inspire others to, you know, make similar connections to what you've described. I think that really helps. And I think you're exactly right. The starting with Be a Hero and sort of laying that foundation of just connecting people to one, learning about us as an organization, and what we can provide. And, you know, all of our campaigns that follow will build on those relationships that start with Be a Hero. So that's fantastic. And you brought up a good point about Nextdoor and like these Facebook sort of group communities. I know I saw on my Nextdoor recently, and I think I've kind of seen this sort of trend up during the campaign, how more people are, you know, they're asking for that help on a place like Nextdoor. Like, I'm a caregiver. There was one I saw who was just like, you know, I work full time, but I'm also taking care of my mom who has Alzheimer's. I need some extra support. Can someone help me find, or someone available to help me, or can you direct me to where I might need that help? And so I think that, again, that is a really great suggestion.
It's good to pose the question, is there anybody here on this Facebook group that has had needs information on caregiving or are currently a caregiver? So you can put that first in your first line, and then people are going to look at that and say, yeah, that applies to me. And they'll more be apt to read exactly what you have there and make a comment or get in touch with somebody.
In social media marketing, they call that clickbait.
So, that's what they call it?
Yeah.
I don't know the term.
You're practicing that. No, that makes so much sense. You're inviting them to engage, and you're reeling
engage
them in.
Right from the first sentence.
Yeah. No, that's so smart.
I didn't even know what a rock star I was. What do I know? This was logical to me.
Thank you.
I'm gonna become one of those influencers, don't they?
Yes.
Have that terminology?
You.
Thank you, Melissa.
Yes. No, thank you, Mary. I saw Sarita posted. She said, I'm going to reach out to the usual suspects, put up some flyers to make my neighbors aware of resources and do social media. That sounds good, for sure. I saw we have Tony K on the line as well. And Tony, I know you're very active in the caregiving space in your community up in Minnesota. And I was wondering if you might be able to share just a little bit about who you might connect with on this campaign. Is Sarita, or not Sarita, I'm sorry, is Tony? Yes, yep, Tony, you're there?
I'm on. Yep, perfect. I am. So I am putting together a caregiving forum, which will be the third Sunday of this month. And it's at my church. And it really is a continuation from Patient Congress, where we had to do a project. And with COVID, everything came to a halt. So kind of bringing that back up to the surface. And there is an organization here in town that my daughter is a participant, and it provides respite care for parents that, young parents that may be struggling, where they need some time away from their kids. And it's been so helpful for my daughter, who's a single parent, and she just needs a break every now and then. And this is an organization that relies on families through various churches that volunteer to provide respite care, and there isn't any cost for that. And it is something that's based out of Minneapolis, but we were so lucky to recently have that added to the Rochester community. So they're going to be presenting as part of the Caregiving Forum this month. And then I'll be sharing resources through NPAF. And I've been doing a lot of work for the past 6 years on caregiving for AARP in our state, and have some videos that my parents were part of. And I just want to say, I am glad that I'm able to attend today, but as caregiver, this is kind of a little too fresh right now because my mom, she did pass away just 2 days ago.
Oh, goodness.
And so she was in hospice, and what I have learned along the way, and it's really unfortunate that as family, when you are taking care of someone, that you learn things in a crisis situation that we really have a lack of hospice beds in our area, even though we've got a very medically based community here, where there was one hospice house that had 8 beds that served 4 counties. And what was interesting to me is that if we wanted my mom in a specific hospice house, that the room and board would not be covered by insurance, but the medical care would. So we were trying to get my mom into a hospice house, but because of all of her insurance issues, she had to spend down her assets. And the cost in our area for a hospice bed was $300 a day. And you don't know how long someone's going to be there. I've heard in the Twin Cities that it is $600 a day that families have to pay for room and board for someone to be in a hospice facility. We had her in skilled nursing, but there's a lot of staffing shortages. So again, this is just an example. These are the types of resources that caregivers are struggling to learn about. And it's helpful to have phone numbers and websites and everything. But what can be very beneficial is to have someone in your community that you can connect with and talk to in person now that COVID is not keeping all of us trapped within walls. And that's something that I hope to approach my church on the need for a physical location for a caregiving resource center. So those are all things that I've been talking about within our community. And you learn along the way, and it's unfortunate that you have to learn in a hard way along the way. So those are some updates for the group.
Wow, Tony, thank you so much for sharing. And I'm so sorry about your loss. I had been thinking of you because I know you shared with me and Mary that your mom had gone into hospice, but just to have you here and to share what you are doing, and even with it being so fresh, just thank you so much. You brought up some really good points that Mary and I have been thinking about as we were, thinking of just actions that we would like for our volunteers to do for this campaign. And we haven't specified it as a part of like the week of action, but one of the things that we had talked about was, what if we got a lot of our volunteers just to start listing off the resources in their own communities, and then we can sort of bring that all together and build that into something a lot more robust over time. And if there's an appetite to do that among the people here, I think that might be a really just sort of fun project for all of us to maybe contribute to. And then, Tony, just let us know how things end up rolling out with the Caregiver Resource Center and just sort of the work that you're doing in your community. Or you're in a really, really amazing advocate.
Thank you, Melissa. I appreciate that. Thank you.
Sure. Now, just I saw Sue also included in the chat that she'll be sharing the resources with her church. A lot of people haven't been attending service because many are caregivers. Also, her new employer, a vascular surgeon, supporter of our mission, and they work with many people who have chronic conditions, and these will be resources that can benefit their families, absolutely. I think the ideas we're hearing here are exactly the connections we want you all to be making in your communities. And Sue, I see you now. Oh, you're on mute. let's see, you're on mute. There we go.
Unmute. There we go. Hello.
Hello, thanks for joining.
I was multitasking, but I was trying to listen at the same time that I was driving. We're under a severe thunderstorm threat, so my counterpart and I quit work early so we wouldn't be driving in a hailstorm.
Well, good. Glad you got home safely, and I thank you so much for sharing just where you plan to share the resources.
Yeah, thank you. It's gonna be great because a couple of weekends ago we had a lady that just has not been in an entire year because she's been taking care of her dad, and one of the pastors said, "Oh, I have to go say hi to her. This is the first time in a year she's been here because she's taking care of her dad." So it's like, okay, so this is where I need to be delivering the story. You know how you get that little message? It's like, he's on cue. It's like, okay, you're up. So I think that it'll be good. Sharing that.
Absolutely.
Thank you.
Thank you. Thank you for sharing that. And we have a couple minutes left. Just still want to just open the floor to others who may want to share, who haven't yet. Yes, I think Rebecca, very good point that we'll be eager to hear the feedback. I think much like we did for our Be a Hero campaign and wanting to get feedback from you all about our Can We Talk About Care Planning guide, which is a lot more of a robust resource. We think this our Can We Talk About Caregiving resource is also helpful, but would be eager to hear some feedback there. All right. Any other questions, comments? All right.
Hey. Oh, sorry.
Oh, go ahead.
No, this is Becky. Hey.
Hi, Becky.
Hello. I was just going to add, and just in agreement about using social media. I created a Facebook group at the beginning of the pandemic to help with things like unemployment, getting your medical card, getting signed up for health insurance. And so I've kind of been using that as a tool to be able to reach people. And unfortunately, I've been spending a lot of time outpatient, and I've just been talking to so many people in the waiting room, and I found that it's like a really great place to like talk about NPAF and what we do.
Oh, wow.
And it's just been really nice to use that as a connection for people. And I know it's so bad to eavesdrop, but like I hear these stories and then I'm like, oh, by the way, here, let me write this down. You need to check this out. They may be able to help, or, oh yeah, I know exactly what you're talking about. Those things need to change. And just kind of, being able to talk to people in person, which is great, just because they're going through things in that very moment, and just like, how am I going to figure these things out? Or like in the chemo infusion clinic, there's a lot of caregivers that they can't go back with their loved ones because it's only one person that can go back. And so they'll be out on the phone talking to someone else like, I don't know what we're going to do about the copay for this medication. I don't know if this is what they want. And these are really great opportunities to bring up what we're talking about today.
Absolutely. I think you're so right about that. Just how there's so many shared experiences in those waiting rooms. And oftentimes when you're just, if you're in that, opportunity, it's a good place to just bring up those resources and make that plug even for Patient Advocate Foundation as that place that can help. Because sort of the genesis of, Caregivers Count is to help people get those resources. And we look to you all as our volunteers to, be, those amplifiers in your community to say, actually, I know where you can go to get help. So thank you so much for sharing that, Becky, and glad to hear your voice, even though we can't see you. I'm glad you could participate today.
Great to hear you guys' voice and see you guys. Hope you all are doing well.
Thank you.
Melissa, I'll make a big plug for the educational webinar that we have on June 15, because we've teamed up with some caregiving powerhouses for that day, as we have in this campaign. And I think that's particularly special, the collaborative partnerships that we're cultivating through these campaigns. As we did with Be a Hero, here in this one, those organizations who are dedicated to caregiving only are partnering with us for the webinar for this campaign. And I think that's a testament to the value that NPAF brings, but also, you know, giving them more light of day out in the broader world, but also vice versa, because the resources that Archangels and the Caregiver Action Network have built are really second to none. And so if we can help distribute really good information that's featured in our new resource, all the better, so that we get it in the hands of everybody. There's the plug. I probably scooped somebody. Sorry, Mary.
No, you're all good. This is perfect.
There's your segue, Mary.
Well, you hit it out of the park. Yes, there are definitely some key dates we want everyone to keep in mind. And of course, when you sign up for our campaign digest, you'll get weekly updates on actions you can take that week and upcoming events. And as Rebecca mentioned, this is an incredibly special webinar that we have coming up on the 15th. So we want you to mark your calendars and register. And I believe the link should be in the chat as well for you to register for that webinar. And of course, our dedicated week of action, which is going to be the 3rd week of the month, and our campaign wrap-up call, where we would love to hear feedback from everyone on the campaign and the actions that you took during this month to bring awareness to the caregiver experience and how you were able to connect people to different resources. And as Melissa mentioned, I think this would be such an incredible thing for each of us to really contribute to. Just, you know, it can start small, just a mini library of caregiver resources that may exist within your immediate community or in your state overall. And of course, over time, that will certainly build into a more national list that we're able to share every year for this campaign.
I really love that idea. I think just to start that with this campaign, and then all the subsequent years that when Caregivers Count comes up, you know, it was a list that was made but with the help of our volunteers. I mean, I think that would be amazing. So, all right, is there another slide or any other reminders? Oh, nope, just thank you. Thank you all. We're still carrying over the heroes aspect of our Be a Hero campaign, because we do think you all are our heroes. And, you know, this is just, you know, we're kicking off. Let us know your feedback. Our contact is there. If you have questions about the toolkit, you find that there's something missing, you know, this toolkit is different from our previous ones. It is on Google Docs, so we have that ability to make adjustments to it, to tailor it to how you all think, you know, you can be most effective. So just, you know, let us know how it can be improved. And yeah, otherwise, just, you know, please share our resource. We're very proud of the work that we've put together. I'm very excited to just see what impact this will make in your communities and just more broadly. All right.
Go team.
Thanks, Nicole. Thank you all. Good to see you guys.
Bye, thank you.
Thank you so much.
Bye, thank you.
Bye.